Hey guys, I'm joined here with Reagan from Altus, who's going to be joining us here on the Brooks Report Live. My name is Adam Brooks. Hey, we have something special coming up for you guys. It's called DocTalk. It's going to be happening here on the Brooks Report Live occasionally. Reagan, tell us what we have coming up.
Adam, thanks for having us, guys. We're so excited. Like Adam said, be sure you like, subscribe, and share so you guys can stay informed and up to date. We're going to be doing all kinds of good, relevant topics that you guys in the community are asking about. And the great thing about this, Adam, is it's a live Q&A with a real doctor. You guys can hop on live time, ask your question to a real doctor. We're going to be talking about important topics like, COVID, what's going on in the current health system right now in the world. So many things that you guys want to know that you're asking about. We're going to talk about it right here, So thank you, Adam.
Yes, sir. Hey, listen, I want to say this is just another one of those things that Altus does for our community to bring us. And so we thank you guys. Listen, put a 1 in the comments if you're watching this live. Go ahead and do that now, and put a 2 if you're watching the recorded version. And don't forget to share this stream. Tag some folks that maybe had some questions you've seen posted on some groups, and, well, they can ask a real doc right here. So thank you, Reagan, for doing this on the Brooks Report Live. We appreciate it. Thank you, guys. Now enjoy.
Hey, Adam, thanks. We love you guys. We love our community. And this is just one more way Altus can give back to you guys. Here we go, guys. Enjoy the show. What's up, Doc? Can you hear me?
Yes, sir. You hear me fine?
I can hear you good. And what's up, Facebook? Thanks to all of our viewers for tuning in to our Doc Talk that we've been doing every other week here. We're so glad you're here joining us. So this week, we're going to be talking about COVID-19, but it's going to be with pediatrics with a little twist on it. So we got lots of different questions you guys have been sending in. Doc, the first one we got is, how can I help reduce my child's anxiety and worry about COVID-19?
Yeah, that's there's a lot going on with kids, especially in the schools. It's not just the anxiety associated with COVID, but just in general, how it disrupts their lives. And, as parents, some of us are lucky to be home or have at least one parent at home, but them not able to go to school as much as they normally do, right? And there's a lot of mix up. I remember initially that my kid, if he didn't make it in time to the lunchroom because if they were separating kids, basically had to eat on the floor or eat standing up, right? So there's a lot of complications that it's not just like, oh, is it COVID, right? Worried about getting COVID, but how it really, really affects them daily, right? I mean, my niece graduated high school and didn't have a graduation, then started college and, didn't really have that college experience because she did it online. And the anxiety is not just about getting COVID, right? Because reality is our kids have probably already had it, especially being in environments that big with that many people. But it's more about how we talk to them and they talk to us and how open they are. And ask your kid questions about their day, and you'll be amazed. Like they lose their seat because somebody was online and then they went in person. So then they get moved classes, they get moved these things, and that's really the anxiousness. I mean, kids like routine, and when you get them out of that routine, it can be stressful for even that child you're not worried about, right? Like there's kids that are a little bit more anxious and then others that are not. But even the kid that just likes his routine and he's normally steady as he goes or steady as she goes can also be affected by it because they were sitting next to friends. Now they're not sitting next to friends. They had to sit on the floor to eat lunch, or they had to eat standing up, or they didn't get lunch. So just talk to them. My kid is 13, one of them, and the other is 2. So my 2-year-old will just talk away. But my 13-year-old is like prying, teeth out with pliers to get information from him. But, it's important to have those routine traditions like dinner, or if you pick them up from school or come home early, just talk to them and ask them because they're not going to tell you because it is their norm now. But you need to try to get it out of them so that you can help them and give them
Yeah, so mental health is still very important, guys. I would encourage you, like Dr. Goffey, engage your kids, talk to them about their day, their routine, because mental health is real, and it's a real issue right now, especially with, different schedules getting shifted because, of people worrying about COVID and different anxieties that arise from that. Another question says, what are the most common symptoms that kids have when they get COVID? What are the top ones? I know there's a lot of symptoms, so.
Wow. Yeah. With, children, they stay a little bit more traditional, like flu, right? That cough, congestion, headache. a lot of kids are not going to really don't complain about loss of taste, like adults do, right? Because we usually make them eat stuff they don't want to eat anyway.
Right.
So I just pay attention to like cough, sniffles, things like that. It's not very different. Fever is going to come to everybody, but in general, with kids, for the most part, they're still completely asymptomatic. Most of the time that kids are coming in with symptoms and getting checked, they're actually not positive for COVID. It's just one of the other million viruses that are out there because they're not usually symptomatic. But cough, congestion, fever, those are big.
So is fever one that you see almost in all the kids that have it? Is fever one of the bigger ones? Okay.
Yes.
Judy just said, how do you know when you are over COVID? How do you know when the kids are over it? Isn't it usually about 7 to 10 days is what they suggest normally?
Right. I mean, you don't want to start swabbing kids left and right. The recommendation is 7 to 10 days from the day of onset of symptoms. Okay. That's when you're kind of clear to go back. You also don't want to scare your kids of sticking these things in their nose every day just to get a negative test. Right.
Right.
That's not
traumatize them.
in the future.
Yeah.
So once they have it, once they're symptomatic, 7 to 10 days, and remember the test that you're getting in your nose, it just says if you're shedding the virus. Okay. This long COVID or regular COVID, or are you over COVID? Your kids or yourself, you can feel symptoms for months, but it doesn't mean that you're infectious. Right. So all that swab does is say, am I shedding the virus at this time?
Okay.
As my immune system kicked in, that I'm not shedding anymore. That's what's happened.
So you were talking about long COVID. What is long COVID? I'm not sure a lot of people know what that is. Is that just COVID?
I mean, it was kind of like, I think it got some traction. A couple athletes started to say long COVID, right?
Right.
And you have to remember what COVID is, right? So it's a virus that affects your entire body. It can make your blood thicker. It gets in your lungs. So long COVID is, if you do an X-ray, even a regular pneumonia versus this COVID as well, your lungs still have that pneumonia for 6, 8, 12 weeks if you follow up and do more imaging.
Wow.
Right? So long COVID is just very relative to how active you are. Like, I'm a runner, right? And I got it pretty bad and I, recovered, but it took me 3 months to run my normal runs, right? And not feel not feel kind of winded on a run that I would just do normally with no problem.
Right.
And that's kind of long COVID, right? I mean, naturally an athlete, a professional football player will feel the effects differently, right, than an average runner because they're at the max, right?
Mm-hmm.
But,
right. Mm-hmm.
That's long COVID is just basically your body fixing the things that it should fix, but it could take weeks.
Yeah.
1 month, 2 months, 3 months.
When I talk to people in the community, I hear a lot of people saying they feel like they're in a funk. They feel like weeks after they're still not their norm. I guess it's just, it takes a while to get back to normal.
It does. It absolutely does. Yes.
Yeah, it takes a toll. And I'm glad you said that. So you can take an X-ray a few weeks later and still see it in the chest sometimes, right?
Right. I mean, standard treatment for a bacterial pneumonia, not COVID, is 10 days, but you could still have the pneumonia looking picture for up to 12 weeks on an X-ray.
Right. So
it's not specific to COVID alone, right? I mean, it's kind of across the board, but COVID does affect more of the lungs, so you can feel more winded than regular pneumonia.
Exactly.
Stephanie, to answer your question, yes, with every virus, if you're running a fever, you are always infectious with any virus.
But you're also infectious if you're shedding still, correct?
Right. Yeah, but the fever itself is very indicative of the fact that the virus is still spreading.
Right. So let's get back to the basics. Earlier, you were talking about, kids can have all kinds of different illnesses other than COVID. I think we forget some of the basics that we should be hand washing, at school every day. Wash your hands. I know it sounds silly, but that can really help stop some of the spread of other things that kids are getting sick with, right?
Yeah. I mean, I hope after all this that we develop those habits that we probably always should have had, like washing your hands after going to the bathroom, washing your hands in general. Do you have to be, with that spray all day, every day? Well, it helps, right?
Yeah. If you're Rochelle and you're watching right now, Rochelle is putting on probably hand sanitizer She's watching us right now and putting on hand sanitizer.
She's washing our hands
like this. She walks around.
She's washing our hands for us.
All of her body. She believes in that hand sanitizer, and she is always putting it on. So, so anyway, just being cleanliness. So go back to the basics can help a lot. Taylor just said, is there a natural remedy that might help offset the severity of COVID in children, like vitamins, medication? That's a good question.
So vitamin C and mostly vitamin D. I mean, I trained in Arizona where it took me 4 months to see a cloud when I moved there in May. Okay. So there's sun everywhere. Okay. And even there, I probably checked the vitamin D levels of over 5,000 patients and nobody was ever in the normal range. Okay. Vitamin D is the foundation, vitamin D and vitamin C, but mostly vitamin D is the foundation for all immune responses of the body. Okay. So vitamin D is something that is in every multivitamin. It's everywhere. I do highly recommend vitamin D, regardless of COVID status. Okay. That's an excellent vitamin that all kids and adults should have in their life in their daily.
Right.
Now, do you want to get a multivitamin? Yeah, those are great. I mean, they have the vitamin D in it. They have everything for kids. They have the Chewies. My little girl has a little Chewy one.
We got the Flintstones Chewy ones. I give my kids.
And they're great. And they have the vitamin D in it. As far as other people doing these strange ivermectin and all these things for a long period of time, once a week, I haven't seen patients that have done that any less sick if they're unvaccinated when they come into the ER. Right. But the vitamin D is something that is treated with every patient, and it does a lot for the patient. The outcomes of patients that are vitamin D non-deficient are exponentially better than those who are deficient in vitamin D.
Man, I'm glad you'd mentioned ivermectin. I've been seeing a million things on the internet. People have been hitting up the feed store here. I think they don't even have, it's been hit so hard. People are having trouble finding that medicine for their horses, their animals.
For everything. Yeah. I mean, and King's has done a really good job. They've compounded it and they have it, but most of the pharmacies, they don't do that. They actually purchase it nationwide and they're having shortages.
Right.
So shout out to King's Pharmacy in Lumberton.
Right. I love King's Pharmacy. They're awesome.
They're fantastic, and they do a good job for the community as well. It has a place in active COVID infections, but when people are taking it, you have to understand ivermectin is something that's very toxic to the liver. So you're doing this dose once a week, and it's just not something that's going to prevent you from getting COVID.
And taking a horse dose, probably way more than what we do.
Yeah, and you have to make sure it's dosed appropriately. I mean, it's weight based. It's not a one size fits all. And you have to be really careful. There's been a lot of people ending up in the hospital from ivermectin, side effects. So make sure that it's prescribed by a physician. There's lots of great studies. So it's not like hydroxychloroquine. Like if you were to come to the ER, if you wanted it, I will write it, but there's really not.
So just curious, do you usually give that when they're early on, or is that something you can give in the middle or later on, or?
So when they come in with symptoms, I will give it. And you basically, the way the active treatment works is you take it on day 1, basically the day that you get it, and then you repeat it on day 3, and that's it.
Is it an antibiotic? Is that what that is, or?
No, it's like for parasites, and it's not really a bacterial antibiotic, and that's why it's pretty toxic to the liver if you take it too much, especially high doses. But if it's dosed correctly, it's perfectly fine. But you want to be careful. You want to be careful because a lot of people are getting it. It's not the same to get the dog one than to get the human one.
Don't go to the feed store. If you get anything from this conversation, do not go get horse dose.
Yeah, because you can't cut it in half. Those medications are designed to take entirely. They're not designed for you to cut in half. It doesn't mean that if it's 10 milligrams that half is 5 and 5. That's not the way they work because they're associated with dog chewing, with taste things. So you can't guarantee half is half. You got to be very careful.
So Terry said she tested negative for COVID, but she is positive for the rhinovirus and she can't get over the cough. Are we still contagious? Never had a fever. I guess that's hard because you have to probably test somebody, for that
RSV, you're usually contagious about 3 days. So if the cough, it just means that it probably got in your lungs, and RSV came out with a vengeance. I mean, we're probably expecting a pretty strong flu case this year as well, just because, we really haven't we haven't really had a lot of flu come into the ER. We've tested people, and when we X-ray their lungs, they're either over the coronavirus or positive for corona, and they haven't been positive for flu. But this next flu season, CDC is saying that it's probably going to be pretty strong. So we just got to be attentive.
Wow. Yeah, I've been hearing a lot about RSV, not flu so much, but a lot about RSV. So I'm sure we're going to see a spike. Obi said, my kiddos are both sick, non-COVID, but also no strep or RSV. Do you think it is just because she is exposed to different bacteria since she started school?
So, with kids, this is interesting. You have to remember, like, if you're vaccinated or you previously had COVID and you get COVID again, you're going to have these strange things, right? You might have fever for a day, you might have cough, you might have congestion. And the vaccine is supposed to keep you from getting the serious disease, meaning like you need oxygen or intubation or ICU care. And because you have remember we talked about shedding the virus, right? So if your body has all these antibodies from previous infection or the vaccine, and you get coronavirus, you're really only positive like a day, maybe, right? Because you have the artillery here that can bind the virus, right, quickly, and therefore it really only gets in the body and sheds for only a day, right? So you can test negative, right, and you're over the infectious period to the world, right? That's why they're saying get vaccinated helps other people, because you're not shedding the virus as long as somebody who's unvaccinated or hasn't gone through the natural infection, right? So if you're testing negative for everything, right, and they're in school, I mean, guys, it's in the schools. I mean, it's everywhere. It's definitely in the schools. I'm sure we'll talk about mask mandates with kids. I mean, I think it's a good probably gateway to that. But having your kids sick, just because they're not shedding the virus or they're not popping positive for the virus, it doesn't mean you didn't have it. It just means the vaccine or the previous infection did its job, right?
Okay. So Greg wants to know, any idea why the CDC doesn't recommend people take vitamin D? Seems they are very silent on taking any vitamins.
That's a little bit of a loss for me. Remember they're really on the Regeneron treatment and they're on the vaccine.
Well, we do know the vitamin D works. We just talked about it. I don't know if you saw it.
Yeah, the CDC is not really big on. They don't really talk a lot about glucosamine or multivitamins. I mean, they're basically medication based for the most part. They do recommend vitamin C for some reason, sometimes during flu season, but they don't recommend vitamin D. I'm not sure why. But the reality is vitamin D is the foundation of all immune response.
Right. So it is good. It's good to take. Cody just said, are people ending up in the hospital because of the animal ivermectin or what the doctor prescribed? So
it doesn't necessarily mean animal ivermectin. It could be that remember you can buy things online from Canada, so it doesn't have to be the animal one. It could be the human one. They just don't know how to dose it. So if you take too much, that's really the biggest thing. Right. It's not just the animal one. It's both.
Missy said, I have a question. I received the first vaccine and was scheduled for my second vaccine. I ended up getting COVID days before my, second vaccine. When I get vaccinated again, can I still use the same company-made vaccine like Moderna, or does she have to go with a different one?
You can do the same one. There's nothing wrong with that. I had a lot of people that it saved their life. The aspect of they got the vaccine about 3 weeks, didn't get the second one. They're older. They're in their 60s, and they did well. I mean, they came in, they were symptomatic, but never needed oxygen, didn't need intubation, didn't need anything. I mean, they felt terrible, but they went home just fine with some medications and did great. And then 30 days later, they took the last shot.
Yeah, my mom, like I said last time, I think that saved my mom and dad getting that first vaccine, and it kept them off the ventilator, just a Diet Coke version of what could have been really bad.
Yeah, exactly. I mean, so, it takes 1 to 2 weeks to start building your own antibodies. So if you got 2 weeks before, I mean, you definitely got a jump start, and that's very good.
So Tiffany said, I was given ivermectin human form for 5 days straight. I experienced low heart rate and low blood pressure for about 2 weeks after taking it. Do you think it could be related? I'm currently undergoing some heart testing now.
So you were positive for COVID? I'm guessing if you were, I don't think it was necessarily the ivermectin. That's not really what happens with it. I will tell you, COVID can cause anything, and there's a lot of issues, and that's why it's important to get checked out. I mean, it has caused a lot of problems, heart-related or blood clots, inflammation, so it increases cardiovascular disease risk getting COVID. So I would bet it's more on the COVID side than the ivermectin side.
Okay.
There is an interesting study about the infusion that post-infusion for like 48 hours, people's normal heart rate that was at like 8, if they lived in the 80s, that it would get a little lower, 60, 70. They haven't found a reason for it, but it's something that cardiologists have paid attention to, people who have gotten it. It's never been an issue, right? I mean, that it's problematic, but they've noticed a baseline like lower of heart rate in some patients after the infusion, but it's been very safe across the board.
So Stephanie's curious, do masks prevent COVID spread? I mean, if they're wearing it right, if they wear it right, does it help at all, you think?
I mean, listen, if you're talking in a big group of people and you're surrounded in a big environment, right? Like people spit on each other, right? So naturally the mask does help. I mean, of course it helps.
Right.
You know, what I think that this, my personal thing with the masks is if it takes a mask to get my child into school, I'm 100% behind it. Okay. I have no problems with it. I'm not going to not let my kid go to school. I will not take a stance of anti-school because, oh, the masks don't do anything. Okay. The masks do something. The problem with kids is there's not masks everywhere in the school. So it's not like the school is providing masks, right? So kids are having masks and then they're like, oh, yours is pretty or yours is cute, you know, and then they start exchanging masks. Or they use the same mask that they had in the bag. And this is even my kid. I have boxes of this stuff at the house and he still doesn't take a new one every day, right? Or he uses a cloth one that he got. And if it's not for me going out of my way to wash it, and I do 24-hour shifts, so I know at least for a day or two, he doesn't wash it. And sometimes kids have to go into a classroom and they lost their thing. They find one on the floor and they put it on. I mean, I know it's gross, right? But this is a reality of what's happening. I mean, this is really, so, you know, is it really preventing the spread? For some people, yes, but it's not. I mean, the kids are getting it because no matter what, I mean, the mask is not perfect, right? It's not.
So just curious, Doc. I've heard people say this. If you keep wearing a dirty mask, let's just say you wear it for a week or two, the same mask every day, can you get staph from the bacteria from wearing that nasty mask over and over?
Well, staph lives on us, right? And that mask, the older it is, I mean, it can cause, you know, little skin breaks and stuff like that. Yeah, you can.
Because you might get something worse that's not COVID from a dirty mask, you know?
Right. I mean, yeah. I mean, there's, you know, you get somebody else's mask that had COVID, RSV, or flu, then you can now start spreading the flu, you know, that way.
Right.
Listen, again, we talked about anxiety for the kids. If it takes masks to get my child to school so that they continue with social development and those things, then I'm all for it. I mean, I'm all for it.
Right.
But, you know, the truth is if they had natural immunity, or they had the vaccine, they should be fine with or without the mask, just like an adult should. But yeah, if you're going to a sports game, there's a lot of people. There's nothing terrible about wearing a mask. I mean, I'd rather go watch the sports game than not.
Right, exactly. I always think a little bit shield is better than maybe no shield. A little barrier better than nothing. So
yeah.
So
and another thing work because that's all I wear in the ER, right?
Right.
And I've had COVID a few times, but I don't really get it from work. I usually get it because, you know, people come over the house. I mean, that's the number one spreader. You know,
right.
So my nurses are getting it, but it's usually from other events that they attended, or even doctors. You know, we wear masks and it's sufficient.
Right. So another person asked a few minutes ago, you know, here locally, the schools were doing temp checks as the kids would get out just to make sure they had no fever.
Sure.
Do you think that is still a good preventative measure that the teachers or schools should be re-implementing again to check for temperature?
Hey, listen, I mean, at the end of the day, there's kids that go to school that are immunocompromised. Absolutely. If a kid is positive and shedding the virus, has a fever, likely shedding the virus, you know, I mean, I don't like it when my kid gets a fever because it really affects my wife and I as far as work schedule because she can't go to daycare. But we've been doing that since we've been parents. So it shouldn't be any different than with COVID. The kids that are infectious should not be in school. I mean, that's even for RSV, even for flu.
Yeah, I've been hearing that question a lot lately, because they don't do that anymore here locally at all. And a lot of people were asking because some kids don't even know they're running fever and they come in and they're infecting and they don't know.
Yeah, they're usually not complainers, right? The kids usually don't complain. They want to see their friends. They want to go to school. For the most part, I mean,
Right. This gentleman just said schools here locally have PE indoors, and do they do many running activities inside with close proximity to each other? Shouldn't they do PE outside since, if it's a nice day, if they can, so they're not, when you're running, I guess he's saying your lungs are pushing out, I guess, more, could be infecting more inside of a building is what he's trying to say.
Hey, all those things are good. We didn't do it during flu season because it's winter and it's cold outside, and that's kind of the thing. We can't, our lives are designed a certain way. In a perfect world, yeah, you exercise outside. I believe I would rather exercise outside than inside in a gym, right?
Right.
But it's difficult to take kids and walk them because you're all, what are you doing? I mean, now you're walking them through the hallways and you're one way or another, it's still everybody's around each other to either go indoors or to go outdoors, right? And the same kids are in the same class, right? So normally you go by class. So, what are you really preventing, right? I mean, that's different than you personally saying, hey, I'm not going to go to my local gym. Instead, I'm going to run outside. Will that help prevention? Yeah. But the school, they're already together.
Right. I guess he was worried about them being locked in a building, but I see what you're saying. They're going to most likely.
They're already intertwined,
right.
throughout the day. So I don't think it'll make much difference.
Right. So this other lady, go ahead. What's up?
I was just saying this is just common sense. I don't know actual studies associated with it, but because there's not really good ones on that. What all the studies now are more generic, like how many infections from students,
right.
Because my kid has 9 periods. I mean, how could you say it was the gym and not lunch?
Yeah, it's tough. It's a hard call. It's a hard one.
Right.
This lady just said, when should a child quarantine? What is truly considered a close contact for the child that, should stay at home to make sure they're not spreading at school? What would you consider close contact, I guess, that they should stay home?
Think of a dinner party.
Mm-hmm.
If it was dinner party contact, that's close contact.
Right.
I mean, you could walk by somebody in the grocery store and get it, but essentially close contact is a conversation. It's a dinner conversation, things like that.
Okay.
That's close contact.
So do you have any recommendations, Doc, for activities for kids to do if they're, having to self-isolate at home? Anything you can think of that'd be good and safe for them?
Yeah. I mean, getting sun is very important. That's vitamin D, right? I think take that opportunity also to spend some time with your kid, being positive for COVID. Other kids could be mean about that. Kids are tough, man.
Yeah, they are.
Kids are tough. And, they don't go to school and, they miss out on things, right? They're not talking to their friends. And I know cell phone's kind of different than when I was a kid. You can kind of connect with the kids, but really connect with them and talk to them and see how other people are treated when they come back and just ask. And you'll be amazed that, you'll be amazed what kids are going through if you just ask the right questions. Spend some time with them, tell them it's going to be okay. And, that their immunity is going to be better in the long run for it, once they get through it. But it's a lot to take in for them. It's completely destroyed their lives. I mean, especially those people, like I said, the last year's seniors or last year's juniors that are now seniors, like they may not have homecoming. They may not have, graduations, and start talking to them about that now, guys, because I mean, I know I enjoyed my homecoming, and it's something that if they don't get it, like that's a big deal for that age.
That's wild to think, because we were able to have our homecoming, our prom. Right. That's weird to think. They're missing out on all these things.
They're missing out on it. Your kid is freshly going to college, or they're going to A&M, or they're going out of state, or they're going something. They're not experiencing that first year the same. I mean, a lot of their classes are online. Like, really pay attention to your kids and just ask them questions and make sure that everything's all right. Words of encouragement, and things are not normal out there, unfortunately, right? Especially with schools and kids. I wish it was. And Texas, I think, is one of the higher level of normalcy, right? But it's still not the same. I mean, I don't know if certain schools are going to allow Friday night lights. I don't know if Lumberton wise, I don't know if they are or they're not, but I know kids they're going to feel that. I mean, everybody liked to go see Friday night lights, right?
Yep, for sure. For sure. So Gina said, what about all the people surviving COVID without the vaccine? Many people have great immune systems. So I don't know what you think, Doc, but is it so much about me or is it about the other people, that we're trying to prevent this from getting,
at the end of the day, there is nothing better than natural immunity, right? Natural immunity means that you went through it. Okay. That's the best, right? Those of us who got it early, went through it. That is the best. I mean, there's nothing better. That's better than the vaccines. Okay. The problem is that the infectious rate and the way it's replicating this time, it's not what it was that, you had to be susceptible, like elderly and diabetic, hypertensive, obese, things like that. Now you're having 25-year-old healthy individuals needing oxygen and higher level of care. As good as natural immunity is, I want to be around for my kids, and I'm sure everybody else does as well. Right. Or to meet their future partner in life. Okay. And therefore, that's kind of one of those things that it's just a very high risk to try to do the natural immunity way at this point. Like the people who did COVID parties initially, a lot of them had deaths during that. Right. So this is a very infectious and complicated disease that the best route is to avoid it altogether and get the vaccine. Right? Avoid the serious possible complications and get the vaccine. So do I talk about it? Yes, I've always said natural immunity is the best. Okay. But now it doesn't matter how good you think your immune system. Okay. You can be 30 years old and pass away from this virus. And that's not worth the risk, in my opinion.
Right. And I know local people here locally, sadly, 35 age just passed away. Horrible. So curious, since we're talking about this, let's say you're 30, 35, and you get past the first COVID wave, but now you get the Delta variant. If it didn't hurt you then, could it hurt you this second time around with the variant? Or?
Well, I mean, remember, you can still get infected, vaccine or natural immunity, right? So if the question is, you mean you got infected before, and
right.
Getting infected with,
Let's say you made it through. Okay,
it would be the same thing as you have in the vaccine, right? The only thing is if you got natural COVID a year ago, just like the vaccine, now you kind of need the vaccine because your immune system, you don't keep the antibodies forever.
Right. So my question is, let's say I get it a second time with this new Delta variant. Mm-hmm. Let's say I could get sick this time, right? If I don't get vaccinated, I could get, even though I did okay on the first time.
Exactly. You can. Okay. Right. And especially if you're over the 8 to 12 month mark, that the number of antibodies could be slightly lower. So you can get a little bit sicker.
Right. So just because you get lucky the first time doesn't mean the second go around you're going to be 100% solid.
Exactly. Okay. I mean, and it's really more the timeline. I mean, I think you'd be good, if you're under the 8 to 12 month mark. But if you're above that mark, just like the vaccine, they're going to be recommending boosters for everybody, not just the high risk.
All right. Perfect. Thanks, Doc. So a next question, what should parents do if their children become ill with COVID? Do you think they should just try to stay at home as much as they can and just, give them fluids and, Tylenol and Motrin?
Children, young kids. I mean, don't wait for fever. Kids do not do well if they have fever. They're going to be nauseous. They can throw up. They're not going to want to eat. They're not going to want to drink. Be proactive with Tylenol and Motrin every 4 hours. Give one, especially the first day or two. Be proactive, right? I think Tylenol is excellent for fever. Motrin, I feel like they're different humans. When you give them Motrin, all of a sudden they're running around and getting fine. So be proactive. Like if you're going to eat at 12, try to give them Tylenol or Motrin around 11 because that way they're ready to eat. They feel better because the fever's gone. You prevented it. That's what I do with my kids.
Okay. Brittany wants to know. She had COVID a month ago. When should I get vaccinated, and which vaccine should I get if I had seizures when I was younger? Is there anyone better?
Doesn't make a difference on which one you want to get vaccinated just 30 to 60 days post.
Perfect. So either one, Pfizer or Moderna.
Yeah, stick to Pfizer or Moderna. I mean, if Johnson & Johnson is the only one that's around, get it, but stick to Pfizer, Moderna. Those are your best ones.
Perfect. So I got some questions out here for all you moms or moms to be. Can a pregnant mother pass COVID-19 to her unborn children?
So so pregnancy question. So the vaccine's recommended up to 20 weeks. Okay. You give, since the antibody's IgG, that passes through breast milk and it passes through the placenta, right? So you can give the immunity to your kids. Naturally, if you're a mother actively with COVID and, it's kind of impossible for you not to shed on your child. I mean, you're breastfeeding. I mean, there's just kind of no way, right? Now I've had miscarriages come into the ER associated with, children under, around 6 to 20 weeks. You guys have to remember that COVID causes the blood to be very thick, right? Very thick. And when you get pregnant, blood flow is the most important thing, right? And when you get COVID and if your blood is thicker and you're making a child, right, and it's needing to form the placenta and things like that, it causes complications in the womb, right? The infection itself. And that's why the board of obstetrics and gynecology highly recommend people thinking about getting pregnant get the vaccine, because a serious COVID infection is causing, miscarriages.
Wow, I didn't even know that. Wow, that's horrible.
It is. And it's not just, it's not just about, about that. I mean, they're seeing it even in the plastic surgery world where people get, fat, just, they remove fat and they put it, whether in the breast or in their glute area. They're finding that they're rejecting the fat because if they get COVID and, the blood flow is not ideal for it, and they're actually rejecting. So it's across the board in medicine that's happening. It's not just pregnancy. It's not just, it's all those things that you wouldn't think about. COVID is affecting everything. So that's why it's very important to get vaccinated before the 20 weeks, because, having a less serious COVID really is saving a lot of, fetuses and babies, in the long run,
right.
Because the infection does cross the placenta. It does affect the child. It doesn't always mean that it's in their lung, right? But it can affect the maturity of the placenta and the blood flow to the child. They found that, the blood flow challenges, it can have a smaller baby, all of those challenges that can happen with obstetrics.
So real quick, Doc, just so I understand. So you said if you're you just had a baby, you're breastfeeding and you have COVID, you can pass that through the milk. You said the breast milk?
The immunity through the milk. Yes.
Okay.
You will pass you if you're breastfeeding, that's excellent, because if any antibodies you make, you're not going to give COVID through the milk.
Oh, okay. That's what I was wondering.
You would give the antibody, you give the protection to the child.
The child would get it from shedding, I guess. That's how.
That's what I'm saying. I mean,
Gotcha.
It's just you have it on you. And
right. You're so close in contact with the baby.
Right. I mean, there's nothing more intimate than a mother and an infant. So
right. Exactly. So she said, I had COVID in January, recovered without issues. I'm stage 4. Would you recommend getting the vaccine?
Yes. Absolutely.
Definitely. Okay. Awesome. Let's see. So it seems like, I don't know, because you're in the ER all the time and you're seeing all kinds of stuff. Do you feel like we're slowly slowing down for a little bit? Are we hitting a plateau for a second? Or are things still as bad as you think they were a few weeks ago?
So I think our numbers have stayed pretty steady, essentially. What's not changed, because you have to understand, it's not overnight that's going to change, whether our numbers are down as far as how many we're seeing. What's not down is the admission rate to the hospital, right?
Right.
So we're still having problems with beds, because remember, a person's not there one day, they're there 2 weeks, 3 weeks, or even a month on oxygen. So that hasn't changed. So the severity and the complications associated with future care is still associated with where you can go, right? And we're still having significant log jams in the emergency rooms across the state of Texas. So I wouldn't say we're out of the woods. Also, we're getting into the cold season. Which,
so it should probably going to spike again. You got flu, RSV, and COVID. I mean, so much going on.
I mean, right, exactly. Not just COVID. I mean, just in general, we're getting into season where, people are just going to be sick, and therefore that's, going to clog things.
Is there a test you can do, just curious, that can show, or you have to do multiple tests? Is there a test that can show flu or COVID, one that'll do both? Or
no, unfortunately not.
That'd be awesome.
Actually, there's not one that does flu and RSV, and they've been around forever. So
right.
They're unfortunately not.
Right.
That's one of those things. Is how many less things do I need on my nose?
Exactly.
Unfortunately, that's not something that's possible to do.
So, in closing, Doc, one good last question for you here. Stephanie wants to know, what's the best way to protect our kids in school? What's the best thing as parents that we can do to put good measures in place to keep them, safe?
Wash your hands. Go outside. Get some sun. Get vitamin D. Get a multivitamin. With the children, I would tell you the best advice for children is those simple things that we do with washing our hands. But the reality is mental security, mental clarity, and just talking to them about what's going on is the best recipe for kids to do well with this. Okay.
Right.
If they're aware of what's happening and they're not scared of it and they're in control of it, they're going to wash their hands. They're going to understand what's happening. So the more honest you are with them and the more they understand what's really happening, they're going to be successful. Antibiotics do absolutely nothing for antibiotic cream in your nose does nothing. It's a virus. So antibacterial does absolutely nothing for this. Absolutely nothing.
Gotcha.
Yeah, you can't block your nose with Vaseline and not get it, because it can go in your eye, it can go in your mouth.
Hey, I don't know if you remember, but my mom still tries to use this for all of my when I'm sick. What is it called? I know I'm saying this wrong. Menthol.
Vicks. The Vicks.
Yes, Vicks. If I'm sick, guess what? She's my whole body.
Yeah, you get it all over.
Hey, she'll put it on my feet, put socks over it, everything.
I got home, and I went to my mom was watching Penelope, my 2-year-old, and I went to my mom's house, and she wasn't feeling well. So I walk in after my shift to go pick her up, and it felt like, some gyms have the eucalyptus saunas, and so my mom set up those the air misters and the Vicks, and I'm just I'm going to go get my kid up to pick her up, and then all of a sudden my shirt is just drenched in Vicks, and I was like, Mom.
There it is. My sister remembers. Look, mentholate them. I got this Vicks and mentholate them for everything.
Yeah, I mean, it works. Just I think my girl started, when she woke up, she started touching it and just crying, and I was like, oh my God.
Yeah, I got that for everything. And when my kids are sick, I still have Vicks. I think my wife thinks I'm crazy because I'm always putting Vicks on them when they. I'm not into all those what do you call it, essential oils, but I do use Vicks. Yeah. That's the only one.
That's my Big Fat Greek Wedding with the Windex.
So I have to check that one out. That's funny.
Those home remedies. Hey, listen, that a little bit does clear sinuses. It's good. I mean, but it's not going to prevent anything. It's
help you breathe a little bit, at least, maybe.
Exactly. It's symptom control. It's not going to prevent anything.
Little relief there. Hey, Doc. Hey, thanks for joining us. I appreciate it. And to all you guys watching, Dr. Goffey's here in Lumberton a lot. He can give free medical advice. If you have an emergency and you're not sure, come here. He'll talk to you. He's here to help you. Got a great team here to help you at all of our locations. So, Doc, I appreciate you. Have any last words you want to say to our guests watching?
I really enjoy spending time with you guys. I think it's important. I know we've done a little bit of COVID specials, essentially because it's kind of common, but please tell us the topic you guys want. I think this is very important. I really enjoy it. Lumberton is, I don't live there, but it's like my home. I'm there all the time. And I really appreciate everybody there. The community is incredibly nice to myself, my staff, everybody around the fire, the police, everybody that I interact with. So anything I can do for the community, I'm more than happy to do so. So please just ask questions. Any topic you want to talk about?
Yeah, let us know. Put it in the comments. We'll check it out. Definitely put it in the comments.
We're happy to oblige. Okay.
Yeah.
So everybody, you guys have a safe week, and it's been a pleasure.
Hey, Doc, I'll see you around, man. Thank you.
See ya.
Guys, again, thank you for tuning in with DocTalk. You know, it's been awesome. We love our community. We love talking to you guys. Like the doctor said, please leave suggestions below. Anything you guys want to hear, let us know. Put it in the comments below, and we'll talk about it. We try to do this every other week, and Wednesday's the day we usually do it. Sometimes due to schedule conflicts, we have to do it on Thursday or a different day, but usually every other Wednesday. So again, subscribe, like our page, tune in so you'll get those notifications. Be sure to hit that bell. And again, guys, thank you so much for being good to us. Like the doc said, bringing in food to us every day. Our community here is awesome. You guys have taken care of us, keeping our frontline heroes fed. We love you guys. We love our community. And we're here 24/7, all emergencies. We have a free medical screening. And if you're on the way, open that phone up and do an online check-in. We'll have somebody waiting at the door for you guys. We're here for you. We're here for the community. And guys, we'll see you soon. Thank you so much for tuning in. We'll see you next Doc Talk.